So here we are. We're at thyroid, and the symptoms that low thyroid can cause are not fun. It can be weight gain, debilitating fatigue, depression, constipation, postpartum depression, infertility, miscarriages, loss of hair, loss of the outer edges of our eyebrows. So it can be very debilitating and uncomfortable. And as many as 1 in 8 women will develop some type of dysfunction in their lifetime. And unfortunately, again, it's estimated that 60% of women will go undiagnosed or underdiagnosed or undertreated. And thyroid's really important because every single cell in your body has a thyroid receptor site for the thyroid hormone to dock onto. And we cannot survive without thyroid hormone. It affects a lot of women, and again, it can have very far reaching consequences. And, so even a few more symptoms, maybe some cracked nails. Some people actually have cracked heels and very, very dry skin. And again, it can cause an elevation in cholesterol. So if we can kind of match all those, it's kind of fun to see. And let's look at a complete thyroid panel. And here again, I want you to look at your lab work there, and I want you to see how many of these things are actually included in your blood work. And I am going to guess that something called TSH is there. That's kind of the standard, the gold standard that Western medicine doctors utilize. And I'm going to tell you in a minute why that just does a huge disservice. Okay. Let me go back. Hope you're still looking. Now, with thyroid hormone, we won't usually see them all in one place on your lab work. Usually we'll see TSH and possibly free T4, sorry, together. And then if they've actually tested, so this is free T4, free T3, reverse T3, TPO, and anti-TG. These are both antibodies, thyroid antibodies. So you may find these two grouped together on your lab work, but you'll see the others kind of sprinkled out throughout if in fact they have been tested. So let's go to why TSH is not adequate. Okay, so I am going into a little bit of depth here, and just I'm hoping that you'll hang with me because I think it's super important to understand this so you know why and what you're asking for, so you can have a conversation with your practitioner. And if they are not willing to do some tests that you're asking them to do, and maybe they're even dismissing you or shaming you, and I've had many clients, unfortunately, where that happens. If you have an understanding of why you're asking for this, it sure does help you stay in the driver's seat and not allow yourself to be dismissed. Okay. And it's hard when you're sitting in that room not to feel kind of less than. And I've been there myself and I know a lot. So that's why I want to go into this for you with you. So in a perfect world, your TSH, okay, which is the marker that most doctors do measure and then they kind of stop there. In a perfect world, there's a feedback loop of the levels of thyroid hormone in your body that goes back to your brain and then to the pituitary. And if you have adequate amounts of hormones, thyroid hormones in your body, your T4 and T3, then that feedback loop would tell your pituitary how much TSH, which is your thyroid stimulating hormone. So this hormone goes to your thyroid and then tells it how much thyroid hormone it needs to produce. Okay. So your TSH, I want you to hear this, is not even a thyroid hormone. It is produced by the pituitary. It's a stimulating hormone. Okay. It's not even a thyroid hormone. But if this feedback loop isn't working properly, which unfortunately it often does not, then that's all you measure and you're not measuring the actual thyroid hormones, you're missing a big piece of the picture. So let's go to the thyroid hormone, right? It's right up here. And a thyroid gland produces T4 and T3. And it produces 80% of what it produces is T4, and then only about 20% is T3. Why we're built that way, I don't know, because the only type of thyroid hormone that our cells can read or get benefit from is the T3. Your thyroid gland only makes 80% of that, right? So it has to go through conversion, and the majority of that conversion, so we have to convert T4 to T3. And again, we always want, please jot this down, please note it somewhere, that you always want to ask for free T4 and free T3 as far as lab markers. We don't want total. So we got the inactive form and the active form. Then inactive form T4 goes to our liver, basically, and it requires some nutrients in order for that conversion to happen. We need vitamin A, and then selenium, and then zinc. And we require all of these things in order for that transformation to happen. Now, in our liver, with that conversion, we also make a little bit of reverse T3. That's normal. And what can cause our bodies to make more reverse T3 than T3 is stress or cortisol. And if we have a lot of stress going on, then we can have too much T3 be turned into reverse T3. And so that's why this is listed here. I always want to see what your reverse T3 is. So even if your free T3 is low, if I see that the reverse T3 is elevated, then I'm probably going to want to work on some type of stress management, whether or not, we can have stress from, psychological stress or emotional stress, but we also can have physiological stress, okay, going on. So this is a lot, I know that, but this is why TSH isn't adequate. T4 is not adequate. We need to see if that T4 is being turned into T3. And then we do want to see reverse T3 as well. Reverse T3 is going to be the hardest thing to get your doctors to do. If they refuse to do it, don't worry about it. If they're doing your free T3, if they are also testing your antibodies, which is really important, then I think you're good to go. Reverse T3 is kind of icing on the cake, okay? So when I have a client that comes in and she's complaining of things, or maybe even she's not complaining of a whole bunch of things, I'd like to see this whole panel, maybe not the reverse T3, because sometimes we can have the thyroid antibodies, right? That's the underlying cause of hypothyroid and of Hashimoto's, which is the autoimmune form of hypothyroid, and most hypothyroid is caused by Hashimoto's. So I like to see where the antibodies are. And sometimes what will happen is TSH looks great, free T4 looks great, free T3 looks great, but these two are elevated. And so what that does is gives us a window into going, whoops, there's something going on with the immune system. And the immune system is going to start attacking the thyroid gland. And even though it hasn't um, caused enough damage or to cause a problem with producing enough thyroid hormone yet, if the immunoglobulins continue to grow to rise, all right, eventually it will happen. So it's really nice to see that early and up front, and that has happened recently quite a bit. And by the way, I know a lot of doctors, if any of you have ever been diagnosed with Hashimoto's, so one or both of these have been elevated, doctors will often not retest these again because they figure, okay, we've diagnosed you with Hashimoto's, we're going to start giving you thyroid medication, and we'll track your T4. Often they don't track the T3. They'll track your T4, And, we already know that you have the elevated immune markers, so why check them again? The deal is, guys, is that you can reduce your immune markers, the immunoglobulins. You can reduce it in a number of different ways. And what that does then is balance your body out, and there's a good chance that there isn't additional damage done to your thyroid, and your immune system just is calmed down in general. And once we have an autoimmune disease of one kind, we're going to be much more susceptible to getting an additional autoimmune disease. So that's why we want to continue to watch these markers. And if your doctor is not doing that and you've already been diagnosed with Hashimoto's, this is something that you need to include or ask and request to be included in your thyroid panel. And lots of times, a lot of doctors will only give you thyroid hormone, something called the T4 hormone, and they don't keep track to see whether or not that's being converted to the active form, the T3, and that's a problem too. That's when I say we're under medicating. Okay, that was a lot right there. I know it was a huge lesson on thyroid, but it's important because so many women suffer from it. So I mentioned physiological stress. We want to make sure that you get enough sleep. Sleep apnea can be a problem. We have too much on our plate. Inflammatory foods can be a problem. Over and under exercising. Too low body fat. We need to watch out for that. Blood sugar dysregulation. In other words, our glucose is being high, and our insulin levels are elevated as well. And an infection, okay, which can be overt or it can be underlying. We can have underlying viruses that are lying dormant that sometimes wake up and then go back to sleep again.